The Jester Radio Podcast.
Jester Radio, what's happening, guys? Welcome to a new episode. Doctor, thank you so much for coming on. If you want to maybe explain who you are and what you do.
Hi Jesse, thank you so much for having me.
Of course.
My name is Dr. Elfrida. I'm a medical doctor and I specialize in aesthetic medicine. So aesthetics is basically all the non-surgical kind of cosmetic treatments and skin treatments, body treatments as well. So I practice at Anti-Aging Art in Houghton. We're a whole team of people working there. Everyone is sort of a specialist in their own field over there. So we have a very holistic approach, inside out, and we take care of mind, body, face, the whole story.
Yeah. So what is your particular part within, your expertise in the field?
So I'm a medical doctor. We do the medical aesthetic procedures. Mainly the procedures that I do and enjoy most are things like fillers and threads and Botox and all the procedures that involve sculpting and making people look their best, basically. So that's mostly what I do. I do believe that we have to look at the bigger picture. So we have to do an inside-out kind of approach. But my niche is sort of sculpting and injecting the face.
Okay. And when you started studying medicine, did you have the thought process of going into this, or was it obviously to be a GP or?
When I started, there wasn't really aesthetic medicine in South Africa yet, so I'm quite old now. There wasn't anything like that. You couldn't go and study aesthetic medicine. No one thought they were going to have that as a sort of a speciality. I've always been interested in this kind of thing. So I always had something like plastic surgery in the back of my mind. I like doing that kind of thing. I thought maybe something in that direction. But during studying, everything changes. Whatever you think you're going to do is not how it turns out. So I sort of just fell into it. I went on to do my ComServing and internship at Garankuwa Hospital, and there I worked with a brilliant bunch of plastic surgeons who are still my friends, and I sort of fell into it, and I started doing all kinds of courses in aesthetics back then already. Went to become a GP, working in a GP practice as a partner. I did some emergency medicine, almost specialized in that. And in the end, I just did more and more of the aesthetics courses, and I was good at it. So I sort of just fell into it along the way. And in time, it also became a big thing. So it sort of grew in our industry, and I just grew with it, kind of. So I'm lucky that it's ended up being a very popular branch of medicine now.
Well, it is something that has drastically improved and drastically increased the popularity around it. I was actually watching an episode of Modern Family the other night, and Jay, the older guy, had just had Botox or something done in his eye, and something went wrong and it was sagging.
Oh, of course, yeah.
And everyone was like, how could you have done this? How could you do this? I mean, this was obviously maybe in the second season, so it's a long time ago. Now it's completely different. If you say you got Botox, I mean, no one thinks it's weird or strange, or obviously it has improved and the stigmatism around it has improved.
Completely. I think, we still get botched Botox.
Of course.
That happens, and I think that's one of the biggest stigmas in aesthetic medicine still out there, especially in the little bit older age group or more mature age group. People are scared that they're going to look fake or funny because they do see people walking around like that. Maybe not so much a dropped eye, that would be very bad, but we still see people looking frozen or fake or funny. And the moment you can see someone's had something done, it's not been done well, and it shouldn't be like that. So we should look good and fresh and happy and younger and have positive emotions on our faces, but no one should be able to tell exactly what it is that you've had done.
So
they must wonder, wow, or tell you something like, that's such a nice lipstick, not who did your lips.
It's almost, they look at you and they say, this person looks so much younger. Why is that? It's not, I can see that person has had fillers or something.
Exactly. And what I found, it's not always about younger. An interesting thing, I've got two little girls, they're 6 years old now, my twins. And they taught me a lot about this because they look at pictures on my phone. I've got a lot of before and after pics of my patients, decent ones, so they can look at them. So they always tell me which picture looks better. I don't ask them. They started doing that by themselves. And then it's interesting, they always choose the after picture, always. And I wondered why, because we think it's so superficial, beauty, but why do kids even know what looks better? And interestingly, they always say it looks better because she's friendlier, or she's happier, or she doesn't look so sad, or he looks less angry. So they equate that nice looking result with an emotion, always. So I learned a lot from them in this process, actually, that in the end, we want to just help someone to portray a positive emotion on their face. And it's nice also because it has an impact on people's self-esteem and confidence. So it actually, I can see how people change over time when they do these procedures. If it's done in the right way, it has a wonderful effect on people. So it's quite amazing what we can achieve, actually.
Do you get some people that maybe come in and they're maybe looking for something for you to do that's a bit too extreme? And you can't, I'm sure you almost get that every day.
We get a lot of that, and more so now that social media is it's part of our lives, our everyday lives. So Instagram and Snapchat, all of that. People look at everything on there, and then they want everything, and the trends. Everyone wants to look like their Instagram filter. I mean, all of us, who doesn't?
Yeah, of course.
But I think we get a lot of people who want things that won't look good, or that's not sort of normal in a real life situation. It's one thing to look at a photo and to look at someone actually animating their face in real life. It's very different. So we get requests like that, especially with the trends. There's a big thing now with the fox eye look, or the like the little keyhole lips. And I hate terms like that because it's not it's not actually so aesthetically pleasing or normal for someone to look like that. So I do turn people away, or try to do just a little bit, and then when they don't get that result that they're looking for, but that I don't think is good for them, then they sometimes go somewhere else. But I will never overdo someone or do something that I feel is not medically or aesthetically or anatomically right.
Yeah. Well, I mean, you having daughters, obviously they're exposed to what every young lady and girl is exposed to, and that's what people go to the extremes. And your daughters and other girls might see this and think that's what that's what society expects of them.
Exactly.
How do you deal with managing these expectations with your daughters?
They're still very young, so luckily I don't have to worry so much about that yet. I don't even want to think about how bad it's going to be. From a young age, I mean, even now, I do encourage them to just be themselves in every way possible. So I always play on their strong emotions and strong points and talents, never force them into anything. We've got a very good relationship in that way. So I hope that will carry through as time goes. But I know they're going to be exposed to a lot of things, like many of our patients and their kids and everyone. So even with patients also, a lot of young girls come to us wanting to beautify and change and enhance some of their features, and we can do that, and I like to do that for people when we can, as long as it's within a certain limit and we don't get into that whole body dysmorphia kind of thing. Try to make them also see their good features. So it's it's something we're always going to deal with. We always have to work on the emotional side.
That's also it's social media. It's so prevalent in our daily lives, and for kids growing up, it's something that you're going to be exposed to no matter what. And what you do and the treatments that you do not only improve the way people look and make them look younger and help them less frown lines and everything, but you also help their confidence. And doing these treatments help them once they leave, in their daily lives. Exactly,
and that's what I love most about my job. And a lot of my patients I've known for a long time, or I see them coming back, and it's amazing to see how they change over time. With these things that bother us, we all have that. It's not just superficial. You can be as strong as you want in your mind. The world does look at the outside as well, and the energy you portray. And how you look and feel is also going to influence your energy and how other people perceive you. So if we can help, even with the smallest thing, like a frown that makes you always look angry, when you're not angry, if people ask you all the time, what's wrong? You start feeling like there's something wrong with you, or why do people see me like this? It affects the confidence. So if we can do small things to take that away and change the way that the world perceives you, and you can be the self that you feel, it's amazing what that does for confidence. And I mean, who doesn't need confidence in the world? So it's not just a superficial kind of thing. There's a lot that we can do with aesthetic medicine. That's quite amazing. There's some studies also that's been done, and recent ones also, on the effect of Botox, for example, on depression. It's amazing. So we always thought it's because of taking away the frown or the negative emotion that people feel less depressed. There was a controlled study where they injected that and then saline, and then the group with the active Botox literally had less depression symptoms.
Sure.
So we thought it's just that the look, and also the feedback to the brain, because you can't frown and make a negative emotion. But there's a new study now where they injected botulinum toxin or Botox into any muscle in the body, like the thigh, for example, and it still had an effect on people's depressive symptoms.
Sure.
So it's an amazing medicine.
Yes.
And if used right, it has wonderful effects. So everyone should do it.
Is that something that you get and that you do the most?
Botox is very common, yeah. We do a lot of that, not just to treat wrinkles. It's more, I feel very strongly about not focusing on certain aspects of the face. You need to look at the whole picture. So we do a lot of that to just get that positive emotions on the face that we want to portray. And then the other most common procedure is filler. I think the Botox and fillers are so common also because you get sort of an instant effect. So it's that instant gratification that we all want. And it is great. If done right, it can look amazing. And if we do it in the right way, we focus on the areas that age and kind of restore it, or just enhance something. Someone can have the most beautiful jawline or nose or whatever, and if you just add like a little bit and change where the light reflex falls, it takes them like to the next level. And it's great. But that's very common procedures all around. But also a lot of things for skin. We do a lot of treatments for scars, things that disfigure people. So but Botox probably the most common.
Yeah. Is there an age that you say someone's maybe too young? Like if a girl, because most people, it's getting more common for males to come in, and males do it, but obviously there are more females. Is there an age of female that you maybe say, or even male, an age where you say maybe just don't do this yet?
You know what? It depends on the patient. Usually we won't do cosmetic type of treatments on people younger than 18. But if it is something like a scar on the face or whatever, I would do injectables because I see that as a medical treatment. If it's purely because of looks, then we usually don't do it before the age of 18. A good time for everyone to sort of start is, well, you can do it before, but don't wait until after 30. If you want to do preventative treatments and stop the wrinkles and stuff from forming in the first place, if you start around 30, that's great. If you want to start sooner, you can. I started doing Botox when I was 24. My mom wanted to go and she was scared to go alone, so she took me with. I was lucky. But it was more because she needed some support, and I was always frowning. I had a very deep frown line, and people always asked me, what's wrong? Okay. And they thought I was very bitchy, and I'm not. I'm very friendly. So I had that Botox, since I was 24, on and off, not all the time, because I didn't have money always to do it. So only when my mom wanted to go, I could go. But at that age even, and then it's prevented me from having a massive crease between my eyebrows. I would have looked so angry all the time if I never did that.
That's something that people need to understand. It's not just to I've got an insecurity about this, that's why I want to change something about myself. It's preventative. Prevention is better than the cure. And sorting out something that an issue that you might have, maybe your mom has bad skin that wrinkles easier, so you're gonna be like that. So then you get treatments to cure that.
Exactly.
Or prevent it.
Yeah, so you can definitely prevent a lot of things by starting earlier, even with superficial treatments like skin peels and microneedling, if done in the right way, very preventative, but also very important not to have too much too soon, because that can have the opposite effect. We never want to create scar tissue in the skin or things like that. So it's very important to go to doctors that know what they're doing and not just do any kinds of treatments just because you can have them, because that's also pressure. Again, social media, this and that, people see Kim Kardashian doing a vampire facial and now every young girl wants to do it. But if their skin is perfect, they don't need that. It's going to create scar type collagen. If you have bad skin, that collagen is good. It's better than the collagen that you have. But if your skin is great, then don't go and interfere with it too soon. You know, so you need someone to guide you. It's like everything's changed in the world of beauty, sort of. I'm saying beauty, but it's our stuff is medical, but it's still, there's a big confusion still also between beauty and medical aesthetics. But I mean, nowadays you don't go and like buy your cosmetics from Pick and Pay, you know. If you can, you go do it at a beauty salon or that kind of thing. So it's important to get the right expertise to look after your face and your skin.
That's also something you mentioned, Kim Kardashian. I'm sure you get a lot of people coming in, maybe a photo of her, a photo of, you know, celebrity, and being like, try and make my lips like this.
They love that. And people do that often. And then also pictures of themselves with a filter and whatever. And I want to look like I did in this photo or whatever. And exactly. There's a big thing with that. But yes, they do come with pictures of other people's features. And obviously that gives you an idea what people want. But I always look at what the patient has. And then we try and make it as good as we can. If you try and give one person someone else's lips, it's never going to look good on their face. And I try to explain to patients why that works. If you look at Angelina Jolie, she's got big lips. You know, she was the original lip queen before all the Kardashians came. And she could carry that off because she has a very broad jawline. But if you don't have that jawline, the lips won't look good. You know, so it's just that balance of everything. There's, you need to look at the whole picture. But patients come with funny requests sometimes, and we have to be very careful with what we do and don't do. I feel very strongly about that. I feel even doctors, because we all look at all these pictures and ratios and all of that, sometimes start getting sort of change blindness. So what normal looks like have changed in a lot of people's minds. So we start seeing all these huge lips and cheeks and things that actually don't look good, but even the doctors start thinking it looks good. So we have to be very careful where we draw the line.
It's also because you've got someone who's willing to pay you money to do something, but also, you know, they might not be happy with how they turn out afterwards.
Yeah, exactly.
So you have to manage the expectations.
It's a very fine balance, and that's what it's about. I think in the end with aesthetics, there's a right and wrong because it's medicine. I mean, we can actually do a lot of damage if it's not done right. It looks fairly simple, but there's a lot going on underneath that actually you need to know about. But in the end, it's also art. So no two people are going to do the same thing on someone else's face because we all have a different perception of what beauty is. So I guess you have to find the right doctor for you, someone who sees the same beauty that you do for you to be happy, if that makes sense. The best is still to go by word of mouth. I think if you know someone who's been to a doctor, they look good, then go there. But be careful. People mustn't just go anywhere and think one filler is the same as another filler, because we do see bad results as well in the market, a lot of it.
And it's relatively new in the country, and have you I'm sure obviously every doctor that's doing this now is learning as they go, and there's there's revolutionary types of different things that work better in different people, and I'm sure you kind of had to experiment initially to see certain people's lips might respond differently to someone else's lips, or is it something that's kind of just universal and most of the time they respond the same?
Not really. Look, the basics, it's science. So science remains science and that will never change. So we start getting like more different products on the market and things like that as the years have gone on. That you can do different things with. So as long as you understand the science, you can sort of know what will work for a certain person and what wouldn't. So that basically remains more or less the same. What I have experienced with experience, let's say that, over the years, and just not necessarily the years. I mean, I haven't been doing this forever. It's been just over 10 years, but it depends also on the amount of people you inject.
Yeah.
Like the more I do it, the better I get at it, because you start getting little tweaks and things that just work. So everyone also gets their own kind of way of doing things, or I have over time, and that's nice for me now. So I can also now I teach other doctors as well. So then that's also a big learning process for me, because I learn from other people all the time. We have to stay on top of the game the whole time. Luckily, there's a lot of teaching and training and things going on. So as long as we keep up to date, but I like to not experiment as such, but we try and always find new ways of doing things better and combinations that work better for people, and be innovative, but still staying within a safe framework when it comes to science and anatomy and medicine.
Yeah. I don't feel this way, but have you ever experienced maybe from another doctor who's maybe a GP or a surgeon or something, looking at you and saying like, you've kind of took the easy route, even though it's not easy, but it's you know what I mean?
I think there is that perception still out there that if you couldn't become a plastic surgeon, you become an aesthetic doctor, right? Which is not the case. I don't think people always understand how it works in South Africa. Also, you can't just go and specialize in what you want to. Firstly, you have to get a spot, and that's like a whole story. But some people or some doctors, in the past, I think have sort of looked down on it a bit. But now it is becoming sort of a recognized specialty. There is now also a formal postgraduate qualification in this through the FPD, which is a independent university. So I've recently completed that also. So it is becoming more recognized. I think as long as you're good at what you do in the field. Look, there's a lot of, you can do one course in Botox if you're a doctor and inject it. Does it make you good? But as long as your work is good and the patients look good and you sort of build up a reputation over time, then people tend to respect the speciality.
Well, I mean, a somatologist, someone can't do Botox. It has to be a
that's illegal in South Africa. In the UK or in London and in America, you do get nurse practitioners and then some beauty people who can do this. They don't have the same laws that we do. But in South Africa, it's completely illegal, actually.
And I'm sure there are a lot of people that do it.
It's happening. It is happening, So, and it's a bit scary because there's a lot of things that can actually go wrong. It looks fairly simple, but it really is not. So people must do their homework.
And I'm sure you walk on the streets sometimes, the shops, wherever, and you see people with bad, something that you saw like, I could have actually done a far better job.
Yes, so my eye is trained for this. I mean, it's what I do. So I see everything in people. It's like when you talk to a psychologist and you have to be careful. Same kind of thing, but in a good way usually. But I can see when you've had Botox or whatever and it's not done right, obviously. Sometimes you want to just call someone and say, okay, let me just help you. But so there's, the thing is that with this field, there's such a big scope, and that's why I said you have to go by word of mouth. Look at people that look good, and then you're going to get a good result from the doctor you go to. What's also happening a lot, people are still asking us, so I get so many messages on Instagram, people asking me, how much do you charge per vial of filler or per unit of Botox? And that is completely wrong, I think. I've been trying to educate patients also, a lot of us in the industry actually. you're not buying goods. It's not like it's not a buying and selling thing. So you can't compare one person's price per vial to another person's price per vial. It's not like you're taking it and leaving the practice. You pay for skill and artistry and expertise as well. So we shouldn't be comparing like a mil per mil kind of price, because that kind of shopping for a good price is where people often get into problems and not get the results they want.
And